We've seen some encouraging trends of late when it comes to the virus. COVID cases and hospitalizations have fallen in most states. They're falling nationally in the past few days. So that's good. We appear to be on the other side of that latest third wave, which was by far the worst. Also, vaccine news continues to be a bright spot. Today, Russia's two-shot vaccine was shown to be highly effective in providing strong protection against COVID, according to peer-reviewed findings published in the Lancet Medical Journal. So there's another vaccine on the case globally, and the New York Times reports. Get this. Out of the roughly 75,000 people who've received one of the 5 vaccines in a research trial, not a single person has died from COVID, and only a few people appear to have been hospitalized. All undeniably good news. But I've reported on good news before here, and it's followed by bad news always. So we are very much not yet in the clear. Joining me now is Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases. Great to have you back on, Dr. Fauci. Let's talk about vaccine efficacy. We've talked a lot about the national picture here, but Sputnik is a reminder that the whole world's fighting this. Does it matter to Americans that other places get vaccinated and get vaccination programs up?
Oh, absolutely. That's why it's really very good news about the success of the Russian trial, which showed more than a 90% efficacy. That's exactly what you want. You want to get the virus suppressed throughout the world, because when you're dealing with a pandemic, if there's a good degree of infection and spread in any part of the world, it's always a threat to where you are. So, I mean, if you really want to crush a pandemic, it's got to be a global effort. I mean, it's obviously very important to be successful. And as you showed the curve, Chris, of the infections going down, hopefully we'll continue that downward trend. And hopefully, as we get more and more people vaccinated, the level of infection in our own country will get lower and lower until it really is not a threat. But if we do that in a vacuum, without the rest of the world also suppressing the virus, it'll be a continual threat hanging over us. So it's very important that the rest of the world get vaccinated. That's why I was very pleased to see the result of the Russian study.
Another vaccine that is being used internationally, but not in the U.S. as of yet, is the AstraZeneca vaccine. That was a joint project with Oxford. There was some problems with the trial, but ultimately it did get approval in the UK. It is actually being administered in the UK. And I've seen some people, respectable folks in the field, wondering if the U.S. is waiting too long on AstraZeneca, if the FDA schedule is too lax, if we should be pushing to get that out into the hands of Americans, even though, as you see there, 3 countries are not recommending it for seniors.
Well, that's right. There is a little bit of a controversy about that. I think for the most part, the news is reasonably good. But we have a trial going on right now in our own country that we would like to see the data of that phase 3 trial, which is a solid, well-organized trial, so that we can make the proper decision about the safety and the efficacy and what place it will have among other vaccines. I mean, the good news is, Chris, that in addition to Moderna and Pfizer, we have the J&J, the Janssen one, where the trial came out and showed a good degree of efficacy, particularly in advanced disease. We have Novavax, which is another vaccine platform, which is a soluble protein that we're looking upon favorably, and hopefully we'll get some good data there. So there are a lot of vaccines in the mix here right now, and I believe the process that we're going through is the proper process to get the good scientific data to make good public health decisions.
It's possible that you have lost audio from me, so I'm just saying that in case you're blinking at me uncomprehending. You have. Let's do this. Let's take a quick break. We will be back with Dr. Anthony Fauci. We have him back. Thank you, control room. Dr. Fauci, you got me there?
I got you. I can hear you now, Chris.
Okay, good. So when you talk about the sort of, we have a number of vaccines, right? So there's a number that have been have these emergency use authorizations. There's others coming up. So the way that I've been thinking about vaccines, and maybe we can just talk through this, right, is that to get a person vaccinated, it's like 3 cherries on a slot machine. You need to have the vaccine supply, right? Someone's got to make the thing. Then it's got to be delivered to someone who's got a syringe, and then there's got to be another person with an arm who wants it, right? So we got to supply the vaccine, we got to deliver the vaccine, we need demand for the vaccine. What is the obstacle now to American scale? What is the limiting condition on how many people we can vaccinate right now of those three factors?
Yeah, well, there is a very minor component of some parts of the country in which it is inefficient getting it into the arms, and there's some vaccine on the shelf. But overwhelmingly, if you look at the entire country, the supply does not at this point meet the demand.
Right.
So if you get on the phone with mayors and governors, the biggest complaint is we need more vaccine. Get us more vaccine. There are a couple of locations where they're inefficient in getting it into people's arms. But I can tell you, Chris, I'm on the phone a lot. I just got off the phone literally a few minutes ago with the mayor of a big city, and that was exactly what the person was saying. Get us more vaccine. We need more vaccine. We will be doing better as we get into February and March and April. There will be an escalation of doses that are available, not only from the Moderna and from the Pfizer, but also from the other companies, the one I mentioned, the J&J and the Janssen and the Novavax. We will be getting more. But right now, we need to get more vaccine in the hands of the administrators who are going to be administering the vaccine.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.